Now, back to Coastal Living on KZTV.
Well, hello beautiful, it's Safe Sun Week, and what better way to keep your skin as healthy as possible by talking to Dr. Hinojosa as we learn more about how to keep your skin glowy and fresh, especially during the spring and summer season here in the Coastal Bend.
Skin cancer awareness is so important, especially being down here in South Texas where we're exposed to the sun constantly. I would tell patients it's so important to make sure that you're wearing sunscreen daily. For a lot of ladies, it's easy. We have SPF in our moisturizers or in our makeup, but I would also tell you, don't forget about the areas that we don't commonly think of. So behind your ears, the top of your ears, and another major area are your lips. So nowadays you can purchase chapstick that has an SPF in it, and you want to make sure that if you know you're going to be out in the sun, at the beach or the pool, that's something that you're reapplying quite frequently. So I see a lot of patients here in my office that either have a skin cancer that I'm treating, and that's typically, I'm able to cut it out, and typically we can close it together right away. Sometimes though we have to do other types of procedures if it's a larger kind of skin cancer. And so along those same lines, I often see patients who've had what's called a Mohs procedure done, which is a procedure that's performed by a dermatologist, and then they come see me with the defect after that skin cancer has been removed. So in either way, I'm involved with removing it, but largely more so in reconstructing it, and sometimes that involves moving tissue around from other sites or even doing things like skin grafts. I think if you have any skin lesion that's changing, it's important to get it evaluated. When we talk about skin cancer, we talk about the A, B, C, D, E. So A, asymmetry. Do the two halves of the lesion look different? If you were to divide a line down the two, they should be symmetric. B is going to be border changes. So is the border nice and smooth like a circle, or is it somewhat irregular? C is for color. So do we have variations in the color, or is it all one color? Variations in color sometimes tend to be more concerning for something that's malignant or a cancer. D is diameter. So is the skin lesion very large? Ideally, if it's larger than about 1/4 of an inch, again, we worry about the potential for a cancer. And then E is for evolving. So is it changing in any way? Is it getting bigger? Is it changing in color? Is it not healing? Sometimes we have a skin lesion that scabs over, it bleeds, and then it seems to heal, but then it really doesn't. All of those things could be potentially a skin cancer, and I would tell you to get it checked out and potentially biopsied. I think the best advice I have for you in terms of taking care of your skin is sun protection. I can't stress that enough. So you want to make sure that you're wearing an SPF of at least 30 or greater, and that it protects with both UVA as well as UVB rays. I think if you've just found out that you have skin cancer, I would tell you, don't panic. The majority of skin cancers can be safely treated. And like I said, typically these are procedures where we can just cut it out and close things up all in the same day. I think it's just important to be prepared, find a surgeon or a physician that you trust, and get your treatment right away without any hesitation. In terms of skin procedures that I do here, I do a lot of procedures in my office just under local anesthesia, so it's more taking care of tiny skin lesions that are maybe changing, maybe the mole looks a little bit different, and so during those procedures it's something that I'm removing at that time, and we send it off to pathology to find the diagnosis. And I would tell any patient, if you're concerned about a skin lesion or you want something to be addressed, please feel